also what I'm going to try and be covering today is a huge topic, and a topic that's many people have done a lot of work on, including some people who are on this call. And I want to say at the very beginning that I'm going to be glossing over lots of stuff, and I apologize if I gloss over your favorite thing. And I'm going to be trying to keep this at a level which is engaging and allows us to take a broad survey of the questions that we're looking at, and allow me to connect it from some really basic neurophysiology to some clinical insights if possible, knowing that by being broad, it's going to be hard to cover that and hard to do everything. So again, that's where the questions I think can come in handy and allow us to focus on things that are interesting to everybody. So then, without further ado, let me get started here. So what I'm going to start with is just talking a little bit about what are rhythms, what are they in the brain, or at least how are we defining them and talking about them for the sake of the next 45 minutes or so. And then I'll give a little bit of history, which will get us into the different rhythms. And then I'm just going to sort of go through in a fairly systematic process, sort of like, going through the zoology of oscillations here, taking, each of the major oscillations in turn and giving you a little bit of a hint about how they're defined, where they're found, what their mechanisms are, and where they might be important from a clinical point of view or from a cognitive point of view. It's sort of a guide to the oscillations in a way. Touching on a few other particular issues, aging and other issues, and then some pathology at the very end, and then try and sum up. So that's what I'm gonna try and do over the next 45 minutes here. There we go. So just really quickly, just to get some idea down without getting into too much of a semantic discussion here. Rhythms, oscillations, all sorts of different things that happen in the body and in biology. There are obviously clocks, something which sort of keeps time. We won't be talking about clocks today at all. That's a whole other fascinating area that there are people much more expert than I am that could talk about that, I'm sure. We're talking about rhythms and oscillations. If you look up rhythms, you think of, or look it up in a dictionary, it says something like it's a strong, regularly repeated pattern. An oscillation is some repetitive variation of a measure around a central value. I think most people, when we think of an oscillation, we have in mind a sine wave, something just going up and down sort of regularly. But it's a lot more complicated than that, obviously. And let me just have a listen here as we go on. This is Art Blakey playing, I think, in the 1950s, 1959, amazing jazz drummer. And what's nice about drums is it's one of our easiest ways of thinking about rhythms. But if you listen to even just a few minutes of this, or seconds of this really, you see that there's some nice constant rhythms. You watch the hi-hat go in there. It's really constant. That's a regular repeated pattern. But there's all this other stuff overlaid on it. Frankly, way too complicated for me to think about. He does it sort of without thinking, is my guess. He sort of does it naturally. And you'll watch all these different things happening and all these different rhythms and patterns and oscillations going on. And that, I think, is a really decent analogy for what's going on in the brain. Like, there's all this different activity happening. And what we're going to do today is try and take this apart and just look at different pieces of it. But I don't want anybody to forget that the oscillations that I'm talking about are like one or two beats of what he's doing in the context of this complicated set of activity. So the kind of clocks, the kind of rhythms that we look at in biology, they span a huge range as well. There are rhythms that take place over the course of months. And then there are rhythms and oscillations that take place over the course of milliseconds. We're generally, because it's brain activity, focusing on activity that's occurring on the order of milliseconds and seconds. And that's where we're going to be focusing our attention today. Again, there is lots of oscillations and lots of rhythms outside of that domain as well. All right, so we're also covering a number of different spatial resolutions as well. So we're really going to be talking about from the microscopic, where you can sort of think of spike trains in an individual neuron, that is, action potentials that are elicited in a given neuron for a given input or stimulation. You can sort of see an example here from a layer 5 neuron in a mouse where it has a bunch of spikes on it, and that itself is an oscillation, or can be an oscillation. To sort of looking more in sort of the mesoscopic domain, where there's an interaction of local groups of neurons which produce a local field potential or local potentials. And then finally up to the macroscopic level, where we're looking at dynamics of large groups of neurons. And that's where we're going to be spending most of our effort over the next few minutes, talking about what we see when we look at the dynamics in large groups of neurons. We'll bounce back and forth to the other levels as well, particularly as we think about mechanism. But we're really looking mostly, at the level of the EEG, at the dynamics of large groups of neurons. All right, so that's where we're going to keep our focus. So how do we measure? When I was asked to talk about this, there was a quick hint to talk a little bit about how one measures this. I'm going to gloss over this very briefly. We could spend easily the whole time and much more talking about the ins and outs of how oscillations are defined in neural systems, how they could be measured and quantified. It's actually an area of considerable growth and experimentation and advancement nowadays. But there's some basics that are sort of predicate notions. And the real basic of it is sort of a spectral decomposition of Fourier transform, where you take a signal and you take it apart into different sub-oscillations that are then combined to make the full signal initially. And that's really the basis for the majority of work that's happened in this field, and certainly the early work that led to a definition of different bands. And so in this one panel here on the upper left side, you see a spectrogram of a typical EEG from a normal healthy person, showing power in low frequency bands, and then lesser power in higher frequency bands, and a big peak at the alpha band, which I'll talk about in a few minutes. And this kind of data can then be resynthesized into a visually pleasing output using a spectrogram, where you could look at the distribution of power in different frequency bands, colorized and then shown over time. Here's just an example from a sleep EEG that was done, showing the typical spectrogram during periods of different sleep stages and during intermittent periods of wakefulness. And then you can go on beyond this, and you could focus on one area here. I just circled about a 10 to 12 hertz band of activity, which corresponds to spindles during sleep. We'll talk about those as well. And there are tools that you could use to pull out that band of interest and focus on it and make determinations about the actual rhythmicity and amplitude and how it changes and what its structure actually is. So there's a whole host of techniques that could be layered on top of this, or in fact can substitute for this, that allows us to look at different oscillations in different ways. And again, it's sort of getting back to Art Blakey. It's taking that very complicated music, as it were, and peeling it apart to pull out specific oscillations that are consistent and analyzable, is the name of the game and how this is generally done. And this all started over, almost 100 years ago with this gentleman, Hans Berger, who was developing measures of brain activity and basically the early EEG. And that was the first couple of decades in the 1900s, along with a few other people at the same time, but he was the one who sort of got it done first. And it's really him and his son, because what he did is and I'm not sure that we could do this nowadays, probably not sort of IRB approved. He took his son and he stuck a couple electrodes on the back of his head and started recording. And that's actually what you're looking at here. This is the EEG and then a timing trace from that recording from his son. And you can see there's a nice waveform here that is very periodic and matches the 10 hertz timing trace quite nicely. And this was the first recording of what was first known as the Berger rhythm, and later became known as alpha. Well, actually, he termed it as alpha, the alpha wave. And so this is really the first indication of oscillations. There have been other studies or studies around that same time in animals beginning to talk about rhythmic activity in brain or in neural systems. But it really wasn't until the EEG came along that this full notion of an oscillatory activity or multiple different oscillatory activities in the brain began to be developed. And it took the next several decades before it really even matured into a well-defined nomenclature and phenomenology, understanding these different rhythms. And the major ones that were first sort of talked about are shown here, starting at the top edge of the slide with faster frequencies and going down to slower, the beta band, the alpha band, the theta band, and the delta band. And these were largely recognized purely by eye. This was done, looking at a bunch of traces and seeing these rhythms and then giving them names and recognizing that they had sort of parameters around them without necessarily knowing any sort of mechanistic information at that time. Right? And so now we have a bunch of different named oscillations or frequency bands of interest. As I just mentioned, started on the left-hand side at lower frequencies. There's delta activity, there are slow waves of sleep, there's theta, alpha and beta and sleep spindles, then gamma, high gamma, which is also called epsilon, and then there's high frequency oscillations and very high frequency oscillations. And in the red little fake graph here, I show you that there are some attributes that go along with these different frequency bands and the activity in them that are sort of generalized features. That is, as you move, particularly from the lowest and slowest activity on the left-hand slide up to theta and alpha, you're generally seeing a greater arousal or greater ability to do conscious activity. At the same time, the general rule is that as you move from those lower frequencies to the higher frequencies, you go from fairly widespread and synchronous across the brain to increasingly focal and presumably asynchronous. And you also go from more continuous, that is, it's an ongoing oscillation, to more of a bursting, where you'll get little chunks of time in that frequency band of interest. Now, those are general rules, and I'll refer back to them a few more times, but there are also rules that are broken quite a bit. So let's start with the delta and slow oscillations. These are generally defined as rhythms in the 1 to 4 hertz range. There are rhythms and activity that's lower than that, the so-called infraslow activity, going down to DC activity. It's a whole very interesting area of research, but requires specialized recordings that haven't been done quite as much. But in the delta band, we're in this 1 to 4 hertz activity. This is seen in drowsiness, and especially during sleep and stage 3 sleep, where these really coalesce into slow wave activity. It's also seen in pathological circumstances and really almost any brain injury. So it's a very non-specific finding when the cortex in particular has sustained an injury, and that could be the existence of a tumor or a traumatic brain injury, long-standing neurodegenerative disease, et cetera, will all show this kind of slowing. On the left-hand side here, I'm showing an EEG, multiple channels of an EEG, showing these large amplitude, relatively slow waves that are occurring at about once per second. Each of these vertical gray lines is 1 second. And so you can see these big peaks about once every second or so. On the right-hand side is another EEG, this time from a patient, a participant who was healthy. And this is a sleep, period of sleep, where you have these slow oscillations during sleep as well. And by eye, they're not very distinguishable. There are certain characteristics of them that are different between the two situations, but the overall rhythm and the overall structure of it is largely the same between pathology and sleep itself. This is actually probably the best studied or best understood oscillation in terms of really getting down to a pretty complete description of both the cellular and network interactions that underlie the generation of slow waves, particularly slow wave sleep. And a lot of this we owe to Steriot and work he did in the 90s, along with a number of his postdocs who were both amazingly productive and amazingly detailed in some very elegant work on this project, using primarily cat, but also rodent preparations during sleep and anesthesia and other circumstances.